Welcome everyone to this virtual conversation with AAO leadership here at the Wilmer Eye Institute. My name is Jim Livengood and I'm a member of the Wilmer development team working primarily with our many distinguished alumni, three of whom you'll be hearing from in just a moment. So we're usually able to see many of you in person at the AAO conference, but of course the coronavirus had other plans for us all. So we thought that this would be an interesting alternative in the virtual setting we've all found ourselves in. And of course, during the upcoming AAO conference, there will be the annual transition of leadership from one president to the next. And I think it's notable and really a point of pride that this year's president, Dr. Anne Coleman, and the incoming president, Dr. Tamara Fountain, both trained at Wilmer. And joining them tonight is another Wilmer alum who many of you know very well, Dr. Peter McDonnell, who has been the Wilmer Eye Institute director since 2003. So I hope you all enjoy this conversation. And with that, I will turn things over to Dr. McDonnell.
Thanks very much, Jim, and greetings to all you Wilmer alumni out there. The year 2020 is going to be a fascinating year, and one that medical historians will feature prominently in their books on medical history. And it will be an historic year for the American Academy of Ophthalmology, because this year the virtual gavel will be passed from a woman president to another woman president. And it's a really historic, exciting year for the Wilmer Institute, because the president and president-elect both trained at Wilmer and are true exciting leaders to lead our great organization, the AAO, during this remarkable time in history. So it's my pleasure to introduce the two people that I'm thrilled to be able to speak with today. Dr. Anne Coleman is professor of ophthalmology at UCLA's Stein Eye Institute, and she's also professor of epidemiology at the UCLA Fielding School of Public Health. Tamara Fountain, our president-elect, is professor of ophthalmology at Rush University Medical College, and she will be entering in the role of president when the upcoming meeting takes place. Sadly, we won't all be together in Las Vegas, but we thought it'd be a fun time for you to speak or hear these two dynamic leaders in our field who are leading us through this exciting, interesting time. Anne, you're been president for almost a year now, and I'd love to hear from you how you became interested in serving as a leader for the AAO, and have there been some particularly exciting, interesting, rewarding highlights of your AAO leadership experience to date?
So, well, my interesting really started with getting involved with the Academy. I was put on a committee for medical students and also non-ophthalmologist physicians back in the early 90s. And getting involved in that committee, I then became a committee chair. And then slowly through that, I got more involved with the Academy leadership. So it's been a long process where I've gotten to know a lot of the different committees and the different outreach areas for the Academy. And I never specifically said I want to be president. I just always wanted to do my best and to do a good job and to give back to the profession and my colleagues. And so that's really how I got involved, is that when you show up and you do a good job and try to do your best, then all of a sudden they ask for you to be a chair, and then they ask for you to be a secretary, and then they ask you to run this committee and to contribute. And so that's essentially how I started, I was able to get on a committee and then work hard. In terms of what's been great about being involved with Academy leadership, I think it's really the opportunity to get to know other people around the country, and also to maintain those friendships that I developed at Wilmer, and to get new friendships in terms of the individuals I work with. I think it's also been great to really be able to have an impact on the direction of ophthalmology in terms of how we adjust and adapt to things. It's been really wonderful to see how well the Academy leadership and staff and volunteers really pivoted when the pandemic happened this year. I think that's one of the things that makes our society so great, is that everybody pulled together, and you wouldn't have even known that before March, we didn't have anything on our website about the coronavirus, because by the end of March, we had over 300 pages specifically about the pandemic. And that was due to the work and efforts of everybody involved. So that's kind of been one of the most exciting things for me.
Great. Yeah, it has been interesting to see all the material, high quality material the Academy was able to produce so rapidly. Tamara, same question for you. How did you become interested in serving as a leader for the AAO? Obviously, it's not the huge salaries they pay you, since you have to work for free. And have there been any particular highlights that you're excited about so far in your leadership experience with the Academy?
Thanks, Peter. I want to add one thing about the uniqueness of the passing of the gavel between a woman and a woman. That's the first time it's ever happened at the Academy. And as you point out, we both were at Wilmer in our training, but you didn't point out the fact that we were at Wilmer at the same time. And that's where we met. And we've been friends for the 30 years ever since. So it's especially rewarding for me to take the gavel from somebody like Anne. She's been somebody I've looked up to ever since I first met her in the glaucoma section. She was a fellow and I was a resident. And I think, you know, there weren't many women, and we bonded over that. So, so again, this is a really special opportunity, and really honored to be here with the three of you. I think, like Anne, very few people, I don't know of any actually, who get to leadership in the Academy and say, you know, from the very first day I knew what the Academy was, I was gunning to be a leader there. I think for almost all of us, it began as a natural, organic curiosity in what the Academy was, and a natural tendency to be one of those people who wants to do things and is energetic and curious and makes time. I mean, none of us has time, but we make time to do things for an organization. And very similar to Dr. Coleman, you get into these situations and they give you an assignment. It's usually not a great or glamorous assignment when you're junior in any organization, but you do it because you want to help. And if you do a good job with that, it's interesting how then people remember you. And if you are engaged and ask lots of questions, people remember that. If you've impressed people along the way, that helps. And you just find one opportunity begets more opportunities after that. And pretty soon you look around and someone's asking you to be president of the Academy. And it really just, it sometimes happens that way in many of our organizations. I think for me, there have been so many things about the Academy. If I had to name a couple of highlights, one was in my capacity as a membership secretary several years ago. I had an excuse to hang out with our young ophthalmologists as their supervisor. I was sort of like the dorm mom or team mom for the young ophthalmology committee. And it's incredible how old I felt sometimes, but how energizing it was to work with a new generation of ophthalmologists who learn differently than I did, who think differently than I did, who have different tools available. And so just to draft off of that energy it still is one of my favorite parts of the Academy, is working with the young ophthalmologists. And I would say one other area would be the opportunity to work with international ophthalmologists. Traveling to international meetings as an Academy leader, I had the opportunity to sit in on the Global Alliance meetings. I was invited as a guest just to kind of sit and watch interviews with ophthalmology leaders from societies all around the world. It's astounding how similar our lives are. I mean, ophthalmic disease is the same the world over. And I got a real appreciation for the ways that people, I mean, many countries don't have the level of resources that we do in the United States, and what they are able to do with limited numbers of doctors and limited resources is amazing. And in countries that have resources that we have, what they're able to do as well, I think it's humbling. I think we in America tend to think we are the best at everything. It doesn't take much travel to realize that other countries are getting it done too. And for me, it's been a real eye-opener to be able to get to know and to observe my international ophthalmic colleagues as well.
Thank you. You know, the Academy is such a large, complex organization. It's the largest professional association of ophthalmologists in the world. And it's international, as you said. So, and it serves an important role representing our profession to our elected representatives in Washington and advocating on behalf of the American public for eye care. How does a doctor, an ophthalmologist, develop him or herself to develop the leadership skills to run such a giant, powerful organization? I had the pleasure, Tamara, years ago, you came and talked to our residents at Wilmer about how to develop themselves as leaders. Could you take this question first? What have you done personally to allow you to be so effective?
Well, I would say I just have a natural curiosity, as I said before, and I really am not embarrassed about asking questions. And it's funny because as a resident, you know, I was one of 2 women out of 15. I know the ratio is so different now. And I felt oftentimes that everybody else understood things better than I did, because very few people, it seemed, asked questions. So I assumed that they all knew it and I was the only one who didn't. And so I would always raise my hand and say, no, I actually don't see that macular edema. I'm sorry. Can you help me here? I still can't see it. There's a reason I didn't go into retina. But I think you have to be willing to recognize you don't always have the skill set, and you don't need the skill set sometimes. But you need to know where to get the information to be effective as a leader. I think when I started running meetings, I think one of the things you do many times in these organizations is your sole task with some of this is to run an effective meeting. And you can get books on that and you can read, but you can also, if you've been at the table for a while, look around and see the people who impress you with the way they run a meeting or the way they conduct themselves in leadership positions. And I found myself seeing certain leaders I thought were very effective at what they did. And I always ask myself, what is it about what they're doing that I find so pleasing? Not always can I adapt my style to that person. We might have very different personalities, but I can almost always take something from somebody that I admire and adopt that for myself. So that's been very helpful for me. I got a copy of Robert's Rules of Order just to refresh my memory on parliamentary procedure, just in case we have one of those questions about motions, and once you table something, can you pull it back? And I've already forgotten everything I've read about that. Fortunately, we have a great parliamentarian at the Academy, so hopefully she'll have my back next year. And Anne will still remember all of it, so she'll help me out too.
Definitely.
I know she will. Anne, probably you were a great natural leader to begin with, but are there pearls that you'd share and how you developed yourself in terms of leadership skills?
Yeah, you know, I was thinking about that, and it really started in middle school, I think.
Oh, you're such a gunner, Dr. Coleman.
So in middle school, I started getting leadership roles, and that's a great time because, you know, nobody else wanted them. And I continued on through high school. College, I took a step back. College, everybody wanted them. But I think that, you know, it's kind of like how I got involved with the Academy is that, you know, I'm available and I'm interested in, as Tamara said, I'm curious. But I also, when I make a promise that I'm going to do something, I follow it through. And I've always been very good to my word about that. You know, if I say I'm doing it, and I do it on time. And so I think that that's kind of a very important leadership skill because the people have to trust you, and people kind of follow you when you lead by example. And so that's the way I've been a leader. I really haven't been schooled officially on how to be a leader. I missed the leadership development program, which I wish I had done because it looks great. When I got to do that as a president this year, that was a lot of fun. And I think they learn a lot of important information. And I think when I was in college, they really didn't have classes on leadership, or I didn't realize that they were available to me. They were more in the business school. And so I've done mainly what Tamara said, is I've looked and learned from the leaders that have trained me or that have been at the table. And so I've been very fortunate that Mort Goldberg was my chair at Illinois and then at Wilmer when I was a fellow. And so I learned a lot by watching Dr. Goldberg and how he conducted and ran meetings. And then when I came to UCLA, I had Brad Stratzma, who was almost 180 degrees different than Mort Goldberg, but also a very effective leader. And then I had Bart Mondino. So I've been fortunate to be able to watch these individuals in terms of how they lead. I also got involved with women in ophthalmology, and that was extremely helpful and beneficial because I got to see how the women that were in charge were leading very differently from the men that I had been working with and observing. And so I think using all that, I kind of absorbed it, and hopefully it made me a better leader.
Excellent. So it sounds like going to business school or something like that is not a requirement, but it's a multi-phased project to develop as go from a physician to a leader of such a impressive organization. Now, I've never been Academy president, but I've observed some people closely in that role. And one of the things that's always impressed me is the enormous time commitment required to serve in that organization and also fulfill the demands of your full-time day job where you're a professor at UCLA. And then also, not to mention even balancing your personal life. Are Academy presidents allowed to have personal lives, Anne, or how do you
better.
How do you do all those things? How do you make that all work?
Personal life. Yeah, they are allowed to have a personal life. And I think as time goes on, more and more people are going to be allowed to have personal lives. I think they're very important. But you're right, it is a balance. And I always think about a quote that Tamara told me when we were having one of our friend chats. I think it was in Nashville at one of the Academy meetings or maybe that was, we were in Sun Valley, I think, or Park City.
It's so hard to remember. We've been to so many places together.
Or in one of our many chats and talks, and she was gave me some wisdom that actually I share quite a lot, is that you can do it all, but just not all at the same time. And that kind of was very helpful for me, because it's like I look at life as a long process. You never know how long it's going to be, but I've been a slow burning candle. And by being a slow burning candle, not trying to squeeze everything into a very short time frame, I've been able to balance things better. I think you also have to realize that sometimes things aren't perfect. And, many of us have been really top students for our whole lives. And so it's hard not to get an A or A+. And so it's really being kind to yourself and going, sometimes a B is okay. that works in terms of balance. And I think with family, which is most important, even though I find the Academy very important, my family is the most important. I made sure my daughter, I have one child, knew that she was the most important, and that she would always be supported by me no matter what else was going on in my life. And she was okay with that. And I think that's important to validate the people in your life, how important they are, even though the work you're doing for the Academy and other organizations is also important.
Right.
And just one thing Ruth Williams had said when she and I were both in Women in Ophthalmology working on a meeting, is that she felt that our daughters watching what we did really empowered them to then be able to make the choices in their life, and that they actually were proud of their parents and being able to watch their mothers participate and contribute. So.
Tamara, I just heard the Academy president quote you for your wise advice. Anything that you'd add on how to handle all those things, prioritizing, trying not to compromise too much? How do you think about that?
It's such a personal journey. I agree with Anne that sometimes something has to take a back seat. Sometimes that will be your family. Sometimes that will be your professional life. And if you are supported, then you can make those choices and try, as Anne said, to be nice to yourself. I think that men and women, especially more today than they did in generations past, will value their commitments to their family. And everybody's got a different life. I worked very much part-time partly for the reasons of being a mom, but for other reasons as well when my kids were little. That was just one pathway. There are many pathways. There are people who will say, if you can pay somebody to do something in your household to keep it running instead of you doing it, you need to do that. You know, I don't necessarily agree completely with that. There are intangible benefits to doing some things yourself that don't have to do with necessarily saving time, but it's a personal journey. I think we all get there in different ways. And the focus on a complete and balanced life is an important one that's gotten a lot more, I think, attention than it did maybe in generations past. It doesn't mean that it's easy or that you're going to necessarily strike that balance all the time, but you also know you're not alone and everybody else is struggling with that as well. And we all do, and we all get through it somehow.
All right. Well, Tamara, you mentioned, well, as anybody watching this will immediately know, you two are much younger than me. But when I trained, you know, it was really pretty rare to have a female resident, and essentially we had almost zero women professors. By the time you all came along, there were more women. I'm sure you had female colleagues, as you mentioned, you were each other's colleagues. But still, you must have felt, gee, I'm really in a male-dominated field, I assume. And nowadays, you know, it's the Wilmer residency is predominantly female, has been for about 7 years. And about 42% of the Wilmer faculty are female. So it's the demographics are all different. And I wonder, do you think this has significant implications for the opportunities for women that are training in ophthalmology today? Tamara, what do you think?
Well, when you have, there are different needs that women and men have. Just one, for instance, I had 2 children during residency, and I remember having to express breast milk in a visual field room when it wasn't being used, and put a little sign on the door. And I put the milk in our resident hovel in the small refrigerator with the sign on it, "This is not cream, do not put it in your coffee." And Anne will vouch for this too. Anne, remember when you went upstairs to the ORs, there were 2 doors, surgeon's locker room and the nurse's locker room. There was no such thing. And I guess we should have walked into the surgeon's locker room and seen, you know, Dr. Stark and, you know, Dr. Guyton. That would have been special, I think.
That would have not been good.
So I think when you have more women, you know, the needs, the differences in sort of our biology will come about as well. So I think that you know, it was just the way it was. I won't say that it was that hard to be one of few women because I didn't know any different. I maybe Anne will feel differently than I. I felt supported by many of the faculty at Wilmer. Some people sometimes ask me, what is it like to be Black and a resident at Wilmer? And I said, you know what, the Black part is not that much of an issue, but I very much consistently felt different as as a woman. I felt dismissed sometimes for my opinions, not paid quite as much attention to. Patients, many of them preferred white male doctors, and I had one patient tell me that, an older Black woman from East Baltimore who got dressed in her Sunday best and politely informed me when I inherited her from one of the graduating senior residents that she didn't mean me any harm, but she would much prefer to see a white male doctor. And after I picked up my jaw, I said, well, you know what? You're in luck, because there are a lot of those around that I can find for you. That shouldn't be a problem. So I think it's a totally different era now, and the guys probably feel a little self-conscious and maybe a minority amongst all these women.
I think that's a good point. Anne, you're, as an epidemiologist, you're really aware of the demographics. What does this translate now? Is the future of ophthalmology female, or just more? We'll see more and more women leaders, and this rare historic thing of a gavel passing from one woman to another will become routine?
Well, I hope that is true, because we want the best people, right? So it doesn't matter what their gender is. And so I think you're correct. It's not going to be female, but I think it'll be 50-50, and that's how it should be. That for the population, it's about 50%. And so I think people will be in ophthalmology no matter their gender or sex orientation, and that's how we want it. And I think that it'll be such a field that it won't even necessarily be noticed, that they'll be looking at our conversation 20, 30 years from now, and they'll be going, how odd that they thought it was odd that there were two women that were president back to back. And that's kind of what we want, because we all want to be individuals and be recognized for that and to be the best people for the job. And so I think ophthalmology will always attract the best and the brightest. It's a phenomenal profession. And so I think we'll just get the best. And so be that much it is in terms of their gender or sexual orientation or anything. So,
yeah, in terms of diversity in general, I think when the Academy does things, it just classically does them really well. And I wonder, in your role as president, what's your assessment of the Academy's progress in working to become as diverse and inclusive an organization as it can?
Well, I think the Academy's been constantly working on that. This year, the Board of Trustees just made 2 task forces to really look into it. One on organizational diversity and leadership, to really look and make sure that the Academy is being fair and equally promoting individuals to be leaders and to be inclusive and to make sure it's a diverse leadership. And then they've also got another task force where they're going to look at eye care disparities, which I think is also very important. Another Wilmer alumni, Jonathan Javits, had done some work looking at eye care disparities back with Al Summer. And then I repeated the work several years later while at UCLA. And so we do find healthcare disparities within ophthalmology. And so it's great that the Academy now has a task force to really make sure that as providers of care, that we're really addressing the issues of healthcare disparities in eye care. So I do think the Academy is working hard to truly address this, but I also think it's addressed it in the past because whenever I was a committee chair, I was always informed it was important to balance my committees, not just based on ethnicity and diversity and gender, but also on region, on type of specialty practice, on practice location in terms of private practice or academics. And so they've been aware not just of the typical demographic diversity you want, but also diversity of thought and training and education. As we all know, as Wilmer alumni, things are done differently at different universities and sites of training. And so it's also important to balance that. And the Academy's been quite aware of that and been trying to do that over the years too, so that you have a diversity of thought and knowledge and also training.
Thank you for that. I'm really excited to hear from you all about how you might give advice to a young resident or fellow at Wilmer who sees your example and says, well, I'd like to serve ophthalmology one day in a major leadership role like you two. And I think about business school professors. Some of them write that men and women often lead differently. And so I'm curious whether you've, say, Anne, have you noticed differences in general between how women and men lead? And would your advice differ for a young woman, female resident versus a male resident or fellow in terms of what they should be thinking about in terms of pearls towards an aspiration of being a leader of an organization like the Academy?
Yes, so I personally haven't noticed a lot of difference in terms of how individuals based on their gender lead. I think that I have noticed a difference based on personality type. I think that makes a huge difference, but not gender or ethnicity or anything. I really think it's more personality type that influences it. And so because of that, I'm not going to give really any different advice or information to an individual wanting to go into ophthalmology depending on their sexual orientation or gender or anything. Except that with one caveat for individuals that are going to biologically have a baby, I think that, that can, you have to be aware that that can create some issues for you when you do it during your training so that you have the support you need. That would be really the only thing, just mainly physically, because I think any couple that has a child, once the child's in the world, then, it affects them both equally. But I do think there are sometimes some physical ramifications from having a baby, just like there can be, like if you're in a car accident. And so it's just being aware that that in life you can get through these and there are ways to help you. And as Tamara said today, there are now rooms for lactation help for the female residents or even staff, which helps, I think, normalize things. And so I think that in terms of my pearls, the biggest pearl is to say yes. And you keep on saying yes. And then when you become president, you can start saying no.
Tamara, what would you add? And is there any truth to this idea that women and men differ in terms of their leadership styles?
I think women and men differ in the kind of leadership styles they can get away with and be considered effective leaders. I think women have a much narrower lane in what's going to be considered a good leader. I think there are some men who, because of their personalities, can lead in a way that is rather abrupt or confrontational and still be regarded and admired very highly. And I think a woman is going to have to be more careful if that's her personal style, because she may be viewed differently, even with the same kind of personality characteristics. So I think that's the difference is what society will tolerate. It's not really any difference to me in the leader, him or herself. I think pearls, if I had to give pearls, it would be similar to Anne's. And I would say the first one is that every leader that you look at, whether it's the chairman of the department of Wilmer or the president of the academy or the president-elect of the academy, we haven't gotten here by acing every test and being successful at everything along the way. Each of us has had some failures and some rejections and put our foot in our mouths and had things that we wish we hadn't done. And I think that we're very hard on ourselves. Anne alluded before to the perfectionist tendency for medical students in general, and certainly people in leadership positions. And so I think you have to be real careful about about just be nice to yourself and know that you're not always going to be successful, but keep up with it. If you need to improve, then improve. But sometimes you get rejected or you just don't get something because it wasn't the right fit or it was timing. So try not to internalize it and just keep trying. And I think if you want to succeed in any organization, whether it's your house of worship, whether it's your PTA, whether it's the American Academy of Ophthalmology, it starts by showing up, that curiosity that we talked about before, and then it's speaking up, as Anne alluded to. Say yes when you can, raise your hand. Your voice is important. You might be the most junior person in your committee, on your board, in your organization. That doesn't mean that your view isn't important. In fact, sometimes that means your view is that much more important because you've got a different perspective. You haven't been sitting around the table all the time. You haven't necessarily drunk the Kool-Aid. So that is important for you to have the confidence, even when you're junior and other people might know more about other things. Your voice and your perspective is still important and still vital. So don't be afraid to give it. And I think the final point would be to follow up. And by that, I mean just, if you're going to promise to do something, like Anne said, then do it. Follow through with that. If someone's done something nice for you or helped you along the way, acknowledge that. An email, a thank you note. Be surprised how powerful that is in helping to build the relationships. They're important for every leadership role and everybody who wants to be effective in an organization.
Thank you for that. One last question, and reflecting on the opportunity to talk to both of you tonight. I was thinking about, as we talked about, what a historic year this is for Wilmer, where the Academy president passes the gavel to another woman, both of whom trained at Wilmer. And I think with Michael Chang being appointed director of the National Eye Institute this year, he was a Wilmer resident. And I think to myself, how did David Park become successful, CEO of the Academy, when he didn't train at Wilmer? But then I remembered his dad trained at Wilmer and became a very successful neuro-ophthalmologist. So it begs to me the question, and this is the last question I'll ask of each of you. With hindsight, do you think there was anything about your experience training at Wilmer that contributed to your interest in leadership, your ultimate, obviously fabulous success as a leader in ophthalmology? Tamara, any thoughts about that?
I would say during residency was 1 3-year period of my life when I probably had the least opportunities for leadership. Nothing at all an issue with Wilmer. It's just during residency, you were just trying to take care of your patients and to fulfill your duties. And one person every year got selected as a chief resident. You had a leadership role there. And so I wouldn't be truthful if I said that I honed my leadership chops at Wilmer. But I can tell you, and this is something that I'll never forget, another Wilmer alum said to a group of people, Paul Sternberg, is that by and large, you will not be an effective ophthalmic leader if you are not fundamentally a very good and conscientious physician. And I can't think of a better place to have gotten my foundation in ophthalmology and the confidence that that gives me every day when I see my patients in my clinic than to have trained at Wilmer. So in that regard, if there's any utility to that background, of course, in spades, I learned, how to be the doctor and surgeon that I am now at Wilmer.
And anything based on your experience training as a fellow at Wilmer that you think a chairman like me needs to know in terms of making sure we're providing the best possible environment where future leaders can emerge?
Yeah, because I do think my fellowship was pivotal in getting me very interested in academic medicine and really also starting to establish a lot of the network and connections. And one of the things was that we had a lot of interaction between the fellows and the residents, which hopefully that's continuing at Wilmer. I also was very involved in the They had the different epidemiology study groups that Al Summer would run. And we would have kind of evening lectures and discussions, and the residents and the fellows would go to that. And that got me extremely interested in epidemiology and public health. And so one of the things that I really would encourage the chair to make sure they're continuing is a lot of the educational cross-fertilization among fellows and residents and faculty. Wilmer also had a fabulous visiting faculty program in glaucoma, but also in the other divisions, where the residents would then go out to dinner, and then and I guess right now you can't do that. And so hopefully with Zoom, you somehow keep up those wonderful connections, because some of the faculty I met on those dinners actually ended up becoming colleagues and friends once I went on faculty at UCLA. And I think Wilmer just had such a wealth of opportunities to really create a network that I really haven't seen at a lot of other academic institutions. And I think that's one reason why when people have trained at Wilmer, they know a lot of ophthalmologists, they know a lot of individuals, because even internationally, when I travel in my work in epidemiology or with UCLA, I often run into someone whose path had crossed mine at Hopkins and at Wilmer. So I think it's a wonderful crossroads for ophthalmology, both nationally and internationally.
Well, Anne and Tamara, I wish we could spend another hour talking about your experiences and how you developed yourselves into the most prominent leadership role in American ophthalmology. But all good things have to come to an end. But I want to personally thank you for making your time available. I'm sorry we won't all be together at the Academy meeting in Las Vegas, but for those of you that are attending virtually, I will just point out that our own Michael Repka at Wilmer is providing the 77th Annual Jackson Memorial Lecture this year. And we're sending out a complete list of the over 20 Wilmer faculty that will be making major presentations at the Academy this year. And Jim has sent out an email to you, and we're going to put his contact information on the screen so he can help you stay connected with Wilmer, and we can get you whatever information we can provide. So I'd like to thank you all for joining us to hear from the dynamic duo of Drs. Coleman and Fountain. And for any young woman training in ophthalmology today, I think you couldn't find two better role models and examples of tremendous leadership in our specialty. And we're so grateful that the two of you are leading this great organization during this remarkable time in its history for when there's no playbook. So we're confident in the future of the AAO with you two as our leaders. So thank you very much for joining us tonight.
Thank you.
Thank you. What an invitation. Thanks so much.
That was terrific. Thank you, Dr. McDonnell and Dr. Coleman and Dr. Fountain for sharing your experiences and your insights with all of us today, and for taking some of your time to do this. I know you're also very busy and committed to the field of ophthalmology. So my contact information is on the screen here for you all. So please stay in touch with Wilmer and stay involved. I know that many of you will be seeing each other virtually at the upcoming conference, but we hope that sometime soon, many of us can see each other in person again. Thank you to everyone for your time today. I hope you enjoyed the conversation and have a wonderful time at the conference. Thank you.
Thank you.
Yeah.
Good night, everybody. Stay
Night.
safe.